Now, a growing number of Britons are choosing medical treatment abroad rather than at home, according to a study. Hundreds of thousands of UK citizens turn to medical tourism for numerous procedures, from surgery to cosmetic therapy. Anastasia Cherkina takes up the story.
A hop and skip abroad to see a doctor, that's the reality for a growing number of Brits, packing up their suitcases to get medical treatment in other countries. Because they say the system at home is a nuisance, convoluted, time-consuming and often pricey.
If I was afflicted with something and the National Health Service was saying, well, A, there's going to be an 18-month waiting list, and then I could have the treatment for £2,000–3,000 by going abroad and have it all sorted out in a couple of weeks, I'd do it.
Britain is experiencing an influx of outbound patients who are choosing to spend their cash elsewhere and entrust their health into the hands of professionals far from home. Figures from the Office for National Statistics cite a twofold increase from just a decade ago, at 65,000 patients traveling overseas each year, at a price tag of almost £130 million. In theory, the National Health Service in the UK is free, but waiting lists are reported to be at a 6-year high. Postcode lotteries and costs for more intricate procedures are sending Brits packing to countries like Poland, Hungary, Lithuania, Turkey and others.
In 2009 I went to Belgium to have a gastric band. In 2010 I went to Budapest in Hungary to have my crowns replaced. It's about a third of the price of having surgery in the UK. In addition, you get much better service and the hospitals are so much cleaner.
For those reasons, 47-year-old Sherry Crew believes the decision is a simple one.
Christmas just gone, I went to Košice in Slovakia to have a facelift, a leg lift, liposuction and an eye lift.
It's a lot of money going out of the country that could stay within the country.
62-year-old catering consultant Andrew Carr agrees. He also travels abroad for dental work.
To have the treatment done that I had on the NHS would have been impossible. They just wouldn't do it. You'd have been scratching around trying to find a dentist that ran an NHS system, never mind persuade them to do treatment of that intricacy.
Andrew says he would not have come close to affording the prices at home.
In this country, it would have cost me somewhere in the region of £19,000 to have the treatment that I did, which is why I went to Lithuania.
And that's the reality for tens of thousands of Brits every year. Queuing up at home or footing an astronomical bill is too much to bear. Anastasia Cherkina, RT, London.